Naples, Florida. A young woman in light blue scrubs strides down the sterile hallway of a busy clinic. Clipboard in hand, stethoscope draped around her neck, she greets patients by name, offers reassurance, and disappears behind exam room doors. Her name is Autumn Bardisa, 29 years old, composed, professional, trusted. Over the course of nearly 2 years, she treated almost 4,000 patients. She drew blood, administered injections, and even gave medical advice that would impact lives. The staff relied on her. Patients believed in her. But none of them knew the truth. Autumn Bardisa wasn't a nurse. She had no license, no certification, no formal training to treat a single patient. And soon, someone would make a discovery that would shatter the illusion and expose one of the most audacious medical frauds Florida had ever seen. It started with a single, offhand moment. Late in 2024, a patient asked Bardisa a simple question, a side effect of a common medication. It was the kind of thing any experienced nurse would answer instantly. But Bardisa hesitated. She stumbled over her explanation, then quickly changed the subject. The patient left uneasy. Around the same time, a senior physician began noticing small but strange patterns. Bardisa struggled with routine medical protocols and occasionally asked for instructions on procedures she should have known by heart. Finally, suspicion turned into action. The doctor pulled her personnel file, expecting to see her nursing license, references, and school transcripts. Instead, there was nothing. No license number, no nursing degree, no verified past employment. The clinic contacted the Florida Department of Health, and quietly an investigation began. Investigators worked in secret. They interviewed staff. They reviewed thousands of patient charts. They pored over hours of surveillance footage. A troubling pattern emerged. Bardisa had often worked night shifts and off-peak hours, times when oversight was minimal. She handled medical supplies, accessed patient records, and administered treatments without a single qualified supervisor nearby. Some patients came forward with disturbing accounts. One claimed she gave an injection that left deep, painful bruising. Another said she completely misdiagnosed their illness, delaying critical treatment. And several recalled being given prescriptions without ever seeing a doctor. Then came the smoking gun, a forged nursing license. The signature on it, stolen from a real nurse in another county, who had no idea her name was being used. By January 2025, the case was airtight. Law enforcement planned a quiet takedown. The morning of her arrest, Bardisa walked into the clinic like any other day. She didn't see the plainclothes officers until it was too late. They moved in, cuffed her wrists, and walked her out past stunned coworkers and patients. The woman they thought they knew now unmasked as a fraud. But what drove her to risk everything? According to prosecutors, Bardisa's motive was simple but dangerous: money and prestige. Florida's nursing shortage meant high pay, over $75,000 a year in some areas. Bardisa allegedly told acquaintances she wanted to work in medicine without the hassle of school. And with a nurse's badge came something else she craved: respect. The image of competence, the trust of strangers who believed she was there to heal them. But that trust was built on lies. Today, Autumn Bardisa sits in a Florida jail, charged with practicing nursing without a license, fraud, and multiple felony counts. If convicted, she could face up to 20 years in prison. The Florida Department of Health is now contacting every one of the nearly 4,000 patients she treated, trying to determine how many may have been harmed. The clinic has issued public apologies, but its reputation may never recover. And for the people of Naples, one question still lingers. If someone could walk into a clinic, put on scrubs, and fool thousands, how many other imposters are still out there, hiding in plain sight?